Hi everyone, my name is Dr. Michael Baca-Atlas, and I'm a family medicine physician and addiction medicine specialist. I'm here to talk to you today more about tobacco use and various nicotine products. So, tobacco use is the leading cause of death and disability here in the United States, and more importantly, globally, we're seeing an increased prevalence around the world as it relates to tobacco use. During the COVID-19 pandemic, we have seen increased morbidity and mortality in those with a tobacco use history. Some evidence for increased likelihood of return to use among people in recoveries from substance use and remaining tobacco-free improve their chances for a sustained recovery. So these conversations about tobacco use in our clinic settings is so important for those in recovery. And we should remember that there are higher rates in general in the behavioral health population. And what I mean by that is that those with mental illness account for 40% of current smokers. If we break that down a little bit further, there's some disparities there. So those with ADHD, depression are somewhere in the kind of 40% range, but those with schizophrenia and psychotic disorders are upwards of 70 to 80% prevalence. Now, I know that many of us are treating opioid use disorder in our clinics, and the rates of tobacco use are as high as 95%. And if you work in settings delivering medications for opioid use disorder like I do, that number is probably not at all surprising to you. So what's happening at more of a federal and state level with tobacco use? Well, here in the United States, we saw a decline in cigarette use down to 14%. Now, I know that sounds like a smaller number, but remember, that's out of a population of over 300 million people. So that's somewhere in the 30 to 40 million range, and we see higher rates of tobacco use here in the state of North Carolina, higher than the national average, and that's right around 17%. I think what's most exciting for us who are practicing addiction medicine is that we saw in the past year a proposed ban on menthol flavored products. And so the FDA is working within the next year to ban menthol cigarettes. What's most relevant for our patient population is data suggests the ban would lead to close to 1 million smokers quitting, with a large proportion of individuals from communities of color that have been disproportionately impacted by tobacco use, particularly menthol cigarettes. And unfortunately, over the years, we've seen really heavy advertising campaigns in communities of colors, and which is why we've really seen that this ban for menthol cigarettes is so important for our underserved populations. So now you're in a clinic or you're in your hospital setting, and so we got to ask ourselves, what is the best way to ask about tobacco use? So it's ask, advise, assess, assist, and arrange. So let's break that down a little bit further. Those letters independently don't really mean so much. So we really need to ask about tobacco use in a different way than we have in the past. It's not sufficient just to ask about tobacco. We're gonna miss a substantial portion of our patients who are using either tobacco or nicotine products. And the second A, advice, we really need to make that advice personal. So our patients who are using both maybe tobacco and maybe alcohol or opioids, they are totally aware of the health consequences of their use. So sometimes just attacking it from that angle, it's not sufficient. Maybe a loved one passed away from tobacco use. Maybe there's a financial incentive to stop using tobacco. Let's make it personal. When we think about assessing, assisting, and arranging, this is really getting at asking folks their readiness for change and also making sure that they have follow-up. So now that everyone is an expert in asking about tobacco use with some of these updated pearls, let's move on to tobacco products. Most of us are familiar with cigarettes and counseling individuals about this type of combustible tobacco product, but in 2021, we really need to make sure that we are asking about electronic cigarettes, smokeless tobacco, particularly in our veteran population, and smokeless tobacco can come in forms like chewing or dipping, as it is known to maybe some of our patients. And what's most important to raise here is that the U.S. National Academies of Science, Engineering, and Medicine, they came out with this really important 2018 report. And let's just summarize that here. So we have insufficient evidence whether electronic cigarettes help people to quit smoking. Now, we know that around the globe, individuals may be using electronic cigarettes for harm reduction, but just important to remember that there's insufficient evidence here. Electronic cigarettes increase the likelihood that young people will smoke cigarettes. And simply the long-term health effects are still a major question mark. So there are some newer products that we should be aware of in 2021 when we're doing our counseling and our screening for tobacco, and they are nicotine pouches, heat not burn products, and very low nicotine cigarettes. So what exactly are these? So nicotine pouches are not FDA approved treatment for tobacco use. Very important here. And we know that roughly 13% of 15 to 24-year-olds were past 30-day users of these nicotine pouches. So these are sort of similarly used like smokeless tobacco products. The heat not burn products, these contain what's known as sort of a compressed tobacco plug. These devices look very fancy, they're a little bit more expensive. Very important to remember that they are carcinogenic as well, and these are not FDA approved therapies as well. There are several different brands on the market that the tobacco industry is marketing out there. I think most importantly for the very low nicotine cigarettes, the FDA is actually considering these cigarettes to be more of a policy effort to overall decrease use. And there's some great literature out there that these cigarettes in low nicotine content may actually reduce smoking for millions of people. So in summary, we have talked about tobacco-related updates as it relates to the impact on other substance use disorders and COVID-19, sort of updates related to screening, and just a few different types of new tobacco products for us as practitioners to talk to our patients about. And thanks so much for joining me today.